Have you ever wondered whether your metabolic health could determine your risk of developing cancer treatment-related lymphedema? Hi, everybody. I'm Leslyn Keith, and I've been treating lymphatic disorders like lymphedema and lipedema for over 25 years. I'd like to talk to you today about a paper my colleagues and I published in Medical Research Archives in December 2025. The paper is called, "Could Metabolic Health Help Prevent Cancer Treatment-Related Lymphedema?" This is an open access paper, meaning it's not behind a paywall and anybody can read the whole paper, and you can read it using the link that I provided you below. This is a hypothesis paper. It discusses how a healthy metabolism may significantly reduce your risk of developing lymphedema after cancer treatment or even prevent it altogether. Let's imagine for a second two people who undergo the exact same cancer treatment. They have the same cancer, they get the same surgery, they have the same number of lymph nodes removed, they have the same radiation. Both follow the doctor's recommendations. Yet one develops lifelong lymphedema and the other never does. Why is that? For years, we've assumed that the answer was simply the amount of damage that was done to the lymphatic system. But what if there's another important piece of this puzzle? Our recent paper explores a new hypothesis. Metabolic health may determine how well the lymphatic system heals after cancer treatment. And if that's true, improving metabolic health before or during treatment could become one of our best opportunities to prevent cancer treatment-related lymphedema. So the current problem is that lymphedema is one of the most common long-term complications of cancer treatment. It can occur after surgery or radiation damages lymph nodes and or the vessels. Once it develops, it's usually considered a lifelong condition. Current treatments that include compression therapy, manual lymph drainage, exercise, and even microsurgery can help manage the symptoms, but they're not curative. In other words, most of our efforts begin after the damage has already become chronic. Our paper asks a different question. Can we prevent some cases of lymphedema before they ever start? So why doesn't everyone develop lymphedema? This is one of the biggest mysteries. Many people receive identical cancer treatments. Some develop lymphedema, others never do. That tells us that lymphatic injury alone can't explain the whole story. Research already tells us that certain conditions can increase your risk of developing lymphedema. These can include obesity, diabetes, insulin resistance, hypertension, and metabolic syndrome. Interestingly, all of these are also markers of poor metabolic health. This suggests that the body's ability to heal after lymphatic injury may depend on the health of the entire metabolic system, not just the lymphatic vessels themselves. So why does metabolic health matter? Well, healthy metabolism affects nearly every process involved in lymphatic repair, which becomes important after we've had cancer treatment. Healthy metabolism can improve insulin sensitivity, it can reduce chronic inflammation, it can lower oxidative stress, it can improve blood sugar regulation, it can reduce excess visceral fat, and that's the fat around your organs. And all of these changes create a healthier environment for lymphatic vessels to recover after injury. Even more interesting, research is beginning to suggest that ketone bodies themselves may directly support lymphatic repair. Animal studies have shown improved lymphatic vessel growth. Preliminary human studies suggest that ketogenic diets may improve lymphatic function. Using images of the lymphatics both pre and post-intervention while using a carb-reduced diet. Although the evidence is still emerging, these findings point towards an entirely new way of thinking about prevention. So why do we promote a ketogenic diet? Our paper focuses specifically on a ketogenic diet because among the currently available nutritional strategies, ketogenic diets have some of the strongest evidence for improving metabolic health. They consistently improve insulin sensitivity, they reduce inflammation, they lower triglycerides, they reduce visceral fat. And many people experience these improvements even before significant weight loss. And this is important because we all thought that the metabolic improvements were simply because the person lost weight, but we're getting all of these benefits before weight loss occurs. Because metabolic improvements from this way of eating are favorable, they give us these favorable biological effects. They're seen from the ketone bodies themselves in some cases. And multiple research studies have shown that a ketogenic diet, and it's called this because it promotes the production of ketone bodies, these studies suggest that the ketone bodies themselves reduce inflammatory signaling, they protect cells from oxidative stress, they support mitochondrial function, and they promote healthy lymphatic vessel growth. These mechanisms are still being studied, but together they provide a plausible biological explanation for why ketogenic therapy might reduce the risk of cancer treatment-related lymphedema. It's important that I want to emphasize that our paper is a hypothesis paper. We are not claiming that a ketogenic diet has already been proven to prevent cancer treatment-related lymphedema. This study has not yet been done. What we are saying is this: current evidence from metabolism, lymphatic biology, ketogenic research, it all points towards a promising new direction that deserves rigorous clinical testing. Instead of waiting until lymphedema develops, we may be able to strengthen the body's ability to heal before irreversible damage occurs. If future clinical trials confirm this hypothesis, the conversation around lymphedema could shift dramatically. Instead of asking, how do we manage lymphedema, we may begin to ask, how do we prevent lymphedema? And that could fundamentally change survivorship care for millions of people living with and beyond cancer. But what can you do if you already have lymphedema and would like to manage it better? As I've already discussed in this channel, there are 4 main lifestyle factors that influence how severe your lymphedema is and how well you manage it: nutrition, physical activity, sleep hygiene, and stress resilience. Nutrition is by far the most impactful lifestyle factor. If you would like to get support for reducing carbs and implementing a ketogenic diet, you can join my colleague Robert Erkstam and me at Lymphatic Lifestyle Solutions for as little as $49 a month. See the link below to learn more.